This topic of research covers the question of whether ectopic pregnancies in the rectouterine pouch are viable. The answer lies in the uterine tubes of the female reproductive system at the moment of zygote migration. Typically, after ovulation, the ovum travels into the uterine tube for fertilization in the ampulla region, before a newly formed zygote implants in the endometrial tissue of the uterus. However, 1 to 2% of all pregnancies are ectopic. The blastocyst arises to implant in a number of proximally located sites. 1% of these implantations occur within the abdominal region, most frequently the rectouterine pouch, resulting from a uterine tube rupture. These pregnancies are generally first diagnosed from a presentation of abdominal pain, vaginal bleeding, or in more severe cases, hemorrhage. While this particular ectopic pregnancy has a high mortality rate for both the fetus and the mother, pregnancies in the rectouterine pouch can still be viable due to the highly vascular nature of the pouch itself. The rectouterine pouch, also known as the pouch of Douglas, is a female abdominopelvic structure that is a deep extension of the inferior proportion of the peritoneal cavity. This pouch is located in the intermediate space between the anterior rectal surface and the posterior wall of the uterus. The pouch is formed from a reflection of anterior rectal peritoneum to overlay the posterior surface of the uterus. As such, the pouch is located proximally to the broad ligament, the bilayered fold of peritoneum surrounding the uterus, ovaries, and the uterine tubes, and function as an anchorage to the pelvis. Notedly, the peritoneal cavity is not occluded in the abdominopelvic region. An opening is present in the abdominal ostia of the uterine tubes. This allows for direct communication with the peritoneum and consequently accounts for the ability of the blastocyst to migrate to the site of the rectouterine pouch.
In order for the embryo to continue to grow and develop within the rectouterine pouch, a primary blood supply must be made accessible. This blood supply is derived from the vessels of the right side of the broad ligament of the uterus. Principal arteries and veins which originate here include, firstly, the ovarian artery and vein, and more importantly, the uterine artery and vein, which is the primary mechanism by which the embryo will receive its nutrient-rich blood supply and thus continue to grow and sustain its development.
Uterine arteries run intermediate to the bilayer folding of the broad ligament, supplying both proximal, anterior, and posteriorly located reproductive viscera via extensive branches. Implantation onto such a highly vascular structure therefore allows for higher degrees of viability compared to alternative ectopic sites, as the fetus receives nutrients via these extensive maternal sources through the umbilicus vein within the placental attachment. Viability is possible, although exceptionally rare, with approximately 1 in 16,000 live births recorded.
In the event that the pregnancy reaches term, delivery of the neonate from within the pouch of Douglas requires surgical intervention. The primary procedure utilized here is laparotomy. Here, a large incision or several minor incisions are made through the abdominal wall, penetrating the entrance to the abdominal cavity and granting access to the amniotic sac and placenta. If placental implantation has occurred on vascular areas such as the mesentery, it is left in situ and later reabsorbed to avoid life-threatening hemorrhaging. Particularly for pregnancies within the rectouterine pouch, omentectomies are performed alongside the laparotomy to remove a portion or the whole omentum if the placenta is connected. Ectopic pregnancies in the rectouterine pouch are viable. However, for a pregnancy of this nature to be viable, the developing embryo must have a sufficient nutrient and blood supply. This blood supply is generally accessed from the vessels of the broad ligament of the uterus, the posterior aspect of the uterus, and the anterior aspect of the rectum.